Hello, welcome to our live session. Gerard Massa, the health educator, is the name of the channel. We are answering all your questions in regards to fertility, and in this live session today, we are going to talk about all your answers. If you have been having questions about fertility and you are asking yourself you would like to have your questions answered, on this show we do answer all your questions. Now, the first question that has been asked by one of our viewers is that she always gets abdominal pains during her periods, and also she has tried to get pregnant but things have not worked out. So in this video today, in this live session today, we are going to answer this question. Why does she get abdominal pains during her periods? And then why has she tried to get pregnant and things have not worked out well? We are going to break this session into two, and we shall answer the first part whereby she gets abdominal pains, and then that is during her periods, and then also we shall answer the other part where she has tried to get pregnant but things are not working out. Gerard Massa, the health educator, are the names of the channel. I welcome you to our channel. If it's your first time here, remember to subscribe so that you do not miss any new videos we release every day. Now, when a woman gets her periods, normally this is a normal scenario. This is normal for every woman to see her periods. And when we talk about your periods, when we are talking about the periods of a woman, they are divided into, the menstrual cycle is divided into two phases. The first phase is what we call the follicular phase, and then the next phase, that is the first 2 weeks of your periods, of your menstrual cycle, are what we call the follicular phase. And then the next 2 weeks before you see your periods, that's what we call the luteal phase. The follicular phase makes up the first 2 weeks, and then the luteal phase makes up the next 2 weeks. Now, if at all you have gone, or if you are expecting to see your periods, normally there's going to be a change in the hormones, in your hormones. There's going to be a change whereby there's going to be actually a surge. Their hormones are going to rise, and then there are those hormones which are going to drop. When we talk about hormones specifically, we mean these are chemical messengers. These are chemical messengers in your body. They help you to actually undergo your periods normally, and then also they do control many functions. But remember, we are answering the question, why is our friend getting abdominal pains when she is seeing her periods? The first reason is that when a woman is in her periods, or when a woman is due to see her periods, these hormones are going to cause changes in her body. So the first reason is that the hormones would also be contributing to this. But the biggest reason is that the uterine, the inside of your womb, also known as the endometrium, does shed. Now, the shedding of this endometrium is what we call the periods. But in preparation for your endometrium to undergo the whole process of shedding or periods, normally there's going to be pain. Why? Because the endometrium, in the process of shedding, it's actually going to cause rupture of blood vessels, and when these rupture and then you begin having your periods, then pain is going to be expected. But it's not supposed to really rise and be so, the pain is not supposed to be so severe. If the pain becomes severe, then it is high time you talked with your doctor, who could advise some tests to be done on you. So the number one reason why our friend is feeling abdominal pains when she's actually in her periods is that she could actually be having changes happening inside her womb. As the endometrium, or as the inside of her womb is shedding, then there are chemicals there are changes which are taking place, and these are what we call prostaglandins. These are pain signals which take place, and the periods are happening, but also she is undergoing these changes mainly because of hormonal issues, and also because of the changes in the inside of her womb. But also, if the pain during your periods is so high, or if it is so severe, it could also be that you could be having other things like, for example, masses or cysts. Masses or cysts, these are growths which could be inside your womb, and they could be contributing to this. So when you are a woman and you are having your periods, but the pain is really a lot, then it is actually high time you talk to your doctor, who will advise you to do some tests, for example, the pelvic ultrasound scan. We are going to translate for our viewers who understand also Luganda, and we are saying tuligamba nti mu channel yaffe eno Gerard Massa the health educator twogera ku nsonga ez'ekikyala, era twogera ku bintu byonna by'obadde weebuuza ng'oyagala kumanya ku nsonga ez'ebyobulamu, ogezezaako okufuna olubuto naye nga bikutawaanya. Ku channel yaffe eno tuddamu ebibuuzo byo byonna. So tugambye nti ekibuuzo kyaffe ekya leero, omu ku viewers baffe abuuziza n'agamba nti waba ali mu periods ze afunamu obulumi, afunamu obuzibu nti awulira obulumi bungi nnyo. Tugambye nti obulumi buno buva ku kye bayita changes in the endometrial lining, oba munda mw'abaana okuba nga muli ku shadinga ne muba nga muyiika. We muba muyiika, ebiseera ebisinga kye kimu ebiviirako embeera eno okuba nga owulira obulumi. Ate n'ekirala, oyinza okuba nga owulira obulumi, oba oyinza okuba nga oli mu periods zo ng'owulira obulumi, naye ate nga obulumi buno buli kuva okuba nti maybe olinamuko obuzibu nga obw'ekizimba. Remember to ask me all your questions down below in the comments, and I will be able to answer your questions. Ask your questions about fertility live here, and I will answer your questions. Gerard Massa, the health educator, is the name of the channel, and if it's your first time on our channel, on this channel we do create awareness about fertility and reproductive health. Now, the question was that she gets abdominal pains. Our friend gets abdominal pains during her periods. We've said that these pains are due to changes in the endometrium, in the uterus, and then this pain could also be to presence of other things like cysts or growths in your reproductive system. So we are moving to the next part of the question, and this part is that she also has tried to get pregnant, but things have not worked out. Why? What could be causing her failure to get pregnant? Now, when a woman is trying to get pregnant and things are not working out, you've been with your partner for at least maybe 1 year, or you've been with your partner for 2 years or 3 years, you've tried to get pregnant, but things are not working out, there could be something happening, something that needs to be investigated, something that needs to be checked. Omukyala wabanga agezezaako okubanga afuna olubuto, oba oli mufumbo ogezezaako okufuna olubuto naye nga bikutawaanyiza, wayinza okubanga waliwo embeera egenda mu maaso eyeetaaga okwekebejja. So tugambye nti ekibuuzo kino kibuuziddwa omu ku baviewers baffe, agambye nti agezezaako okufuna olubuto naye nga bikyamutawaanya, obuzibu buva ku ki? So failure for a woman to get pregnant could be that there's a problem with, there's an issue, or there's a problem with her ovaries. She could also be having issues in her fallopian tubes. She could also be having issues in her womb. When a woman tries to get pregnant and she does not get pregnant for a period of 1 year, assuming that she is below 35 years old, if you are above 35 years and you have tried to get pregnant for at least 6 months, it is high time you talk to your doctor, who will go and who will look into this issue and then also have some tests done on you. So we are assuming that this lady, this particular friend of ours, is below 35 years old and she has tried to get pregnant and things are not working out. When you have tried to get pregnant and things have not been so easy, or things have not worked out, number one, you could be having issues with your ovaries. The ovaries are those round structures which actually play a very important function in the growth of what is going to be fertilized. That is, the ovaries play a very important factor, or they have a very important function of helping your eggs or your follicles to grow and develop, and then on the 14th day they will be fertilized. Tugambye nti ovaries geego byebyo ebintu ebibiri playing a function ey'amaanyi ennyo, oba byebyo ebintu ebitereka eggi eriba nga ligenda kubeera fertilized lifuuke omwana. So omukyala waba alina obuzibu ku magi ge ayinza okugezaako okufuna olubuto naye ng'ate obuzibu engeri ki nti buli ku magi n'aba nga tasobodde kufuna lubuto. When you have tried to get pregnant and you are not getting pregnant, you could be having what we call ovarian dysfunction. Your ovaries may not be functioning very well. Next is that your fallopian tubes could be actually blocked. You could be having what we call tubal factor. And then next cause of you trying to get pregnant and things not working out is that you could be having what we call uterine disease, or you could be having uterine factor. When a woman tries to get pregnant and she does not get pregnant, number one, the ovaries could be having issues. The fallopian tubes could be having issues. The uterus, that is where the baby grows, could be having issues. And then also the cervix could be actually also having issues. This is common in women who have what we call incompetent cervix. A cervix which is not competent. When a woman gets pregnant, the whole process takes place. The egg becomes fertilized and it is called what we call a blastocyst. It travels the whole length until it attaches onto your uterine wall or the inside of your womb, and then it begins growing. Now, when this egg when the egg begins to grow, but during the process of growth, the embryo, the pregnancy ends into a miscarriage, there could be a problem. There could be a problem that the cervix is incompetent, it does not close. This can be corrected in hospital, whereby your doctor or your gynecologist will do a visual inspection of your cervix. They will look at your cervix physically by use of a special instrument known as a speculum, and then if they do the confirmation that you have what you call cervical incompetence, then they will do a procedure known as a cervical sacrilege, where they will actually support your cervix with a small thread, and then they will advise you on complete bed rest. Put in prayers, the pregnancy can go up to term. You can actually give birth to a healthy baby. So I welcome our friends Nakabuye Christine. You are most welcome to our live. Tusanyuse nnyo okubanga otujoyinize ku live yaffe. Nakabuye Christine, tusanyuse nnyo era webale nnyo okutujoyininga. Buli lunaku ku ssaawa 11 tubeerawo wano tukola live era twogera ku nsonga eza fertility ne reproductive health. Every day at exactly 5 p.m. That's around 17 hours every day. We do have live sessions here where we do interact, and then we talk about your health. We talk about how you can get pregnant faster naturally. By you knowing, you getting the right information, you'll be able to make wise and informed decisions. So I welcome our friend Nakabuye Christine. I welcome Shanice Robinson. Shanice Robinson, you are most welcome. You have a question for me, and I'm going to answer your question. Shanice Robinson, I hope that's the correct pronunciation. And also, Shanice Robinson, you are watching from Jamaica. Welcome to our live session, Shanice Robinson, and my greetings to all our friends in Jamaica. Tell them that we hold live sessions on this channel. Gerard Massa, the health educator, we do hold live sessions about fertility. So before we answer Shanice Robinson's question, let me complete the other question I was handling. And the question was that she has tried to get pregnant, but things are not working out very well. We said that she could be having what we call ovarian disease, or she could be having ovarian dysfunction, where either the ovaries are not really functioning very well. The follicles, where the egg is produced, the follicles may be having issues that they are not developing normally, or she could be having very low follicles, or she could be having issues with the hormone which is known as luteinizing hormone, which is responsible for the process of ovulation. So if she has hormonal issues, then there are high chances that the ovaries may not be able to function very well. And then we said that she could also be having what we call tubal factor, or she could be having tubal disease. By tubal disease, we mean that the fallopian tubes, the tubes where the fertilized egg travels, could be blocked. The blockage could be due to free fluid, accumulation of free fluid, which is a result of repeated infections, repeated sexually transmitted infections, or repeated urine tract infections can actually end up causing what we call tubal blockage. So you trying to get pregnant and the pregnancy not happening, it could be that the fallopian tubes are blocked. Then the other thing is that the womb, the inside of the uterus, could be having issues. It could be having fibroids. The inside of the uterus could be having free fluid, which we call endometritis. Now, how can you know that there's a problem? How can you tell that there's a problem? I mean, how can you discover, how can you identify that you have issues with your eggs, or you have issues with your fallopian tubes, or you have issues with your uterus? How? I mean, you cannot sit at home and then confirm that you could be having any of these. Now, that's the main reason why we are doing these live sessions on our channel. Subscribe so that you do not miss any session we do put out every day. You are watching and then learning things, and then you also asking questions, me learning from you and you learning from me. That's how things work out, and I'm really so happy that we are interacting. So the only way, or the best way to confirm that you could be having issues in your womb, if you have tried to get pregnant and things have not worked out, you need to go to hospital and then talk to your doctor, talk to your specialist, talk to a healthcare provider who specializes in this area of fertility and reproduction, and then they will advise you on the next steps. The first step, the first test which is always recommended, is what we call the pelvic ultrasound scan. I've talked about pelvic ultrasound scan on this channel. I talk about it every day. We do it every day on my clients. A pelvic ultrasound scan is very good because it is affordable. It is near you. The next clinic near you, they do pelvic ultrasound scans. It can give us a first line assessment of what is happening. Before we go to those complex procedures, you need to do a simple pelvic ultrasound scan. Let the doctor who is doing the scan pay close attention to your ovaries, pay close attention to the fallopian tubes, pay close attention to the inside of your uterus, and then also look at your cervix. The cervix has two parts. It has the internal and then the external. They will be able to look at your cervix, see how it is, and then also they will look at the inside of your uterus, known as the endometrium. They will make a conclusion and then they will advise you on the next steps. If the pelvic ultrasound scan shows that there is something they've seen, then they will actually recommend you to see your doctor, who might also request other tests, for example, the HSG scan, also known as the hysterosalpingogram ultrasound scan. The hysterosalpingogram X-ray test. It is a specialized test which is done at specialized imaging facilities. The HSG scan involves a contrast media, small liquid, which is injected or which is passed through your private parts, and then it travels to your fallopian tubes. But as it is traveling, images or X-rays will be taken, and then interpretation will be done by the radiologist, that is a specialist, who will actually tell us where the blockage is. Now, after identifying the cause of the blockage, management will be very easy. Your doctor will decide on what management needs to be done, either by advising you on the medications or advising on special procedures which involve tubal unblocking. So mu video yaffe tuligamba nti obanga ozuuliddwa nti olina changes ezigenda mu maaso, then doctor wajja kuba akubuulira ekiba kigenda mu maaso. So I hope we have answered the first question from our viewer. She asked on WhatsApp. By the way, you can also post your question on my WhatsApp. It's +256 701 7978 and 76. Ask me your questions and I will pick one question every day and I will answer. But the easiest way is to join me on this live stream every day at 5 p.m. that is 17 hours, and then let us have a live session. So we are going to the questions put forward we have Shanice Robinson from Jamaica. Hello. Yes. So Shanice, you said that sorry, let's check your question. Okay then, I have PCOS. I'm trying to get pregnant for more than 3 years. I did an HSG and was told I have proximal blockage. I was on Clomid, metformin to try to get pregnant and nothing. What can I do? So, Shanice Robinson from Jamaica, you asked a question and you said that you were told that you have polycystic ovarian syndrome, that is PCOS. Now, you were even put on metformin and Clomid, and you actually, before that, you did an HSG, and you were told that you have what you call proximal blockage. Proximal blockage means that the blockage is at the end. So, and you were actually given Clomid and then metformin, but still things have not worked out. Now, first of all, Shanice, thanks for posting this question. Really, we feel for you. So sorry that you were actually told about this, and so sorry that you have this condition, but you need to take heart. Many women with polycystic ovarian syndrome have gone ahead and had successful pregnancies. If you just try to ask around, I believe you'll get 1 or 2 or even more women with polycystic ovarian syndrome who are actually pregnant, who have gone ahead and given birth. Now, polycystic ovarian syndrome, also known as PCOS, is a hormonal disorder. It's a disease of the hormones. It's a condition whereby a woman produces, or a woman has, lots of the male hormone known as testosterone. The male hormone or the androgens, they do rise in a particular woman, and then they actually do bring about development of small fluid-filled swellings on the ovaries. These are what we call cysts. A cyst is a swelling which contains fluid. Now, many women have cysts. Actually, like today, I've just worked on clients, like two women, they have cysts, but these are functional cysts. Functional cysts are swellings, but normally it is one. It is 1 or it is 2, and then, no, but in most women, they have only 1, and they do measure 0 up to 30 millimeters. They normally do not exceed 30 millimeters. But when a woman has these swellings, and then these swellings are very many, they are more than 9. When anything is a lot, when something is a lot, when it is a lot, we say it is poly. So the name polycystic ovarian syndrome specifically means that a person or a lady has many swellings on her ovaries. Now, in this particular case, I'm trying to get pregnant for more than 3 years. I did an HSG and was told I have proximal blockage. Now, I was on Clomid, metformin to try to get pregnant, and nothing has happened. What can I do? Before we went for the HSG, before you went for the HSG's X-ray checkup, I believe you first did an ultrasound scan, Shanice, and it is the ultrasound scan which confirmed the PCOS, which confirmed the polycystic ovarian syndrome. And then I think afterwards, the doctors sent you for the HSG scan, whereby they confirmed the proximal blockage. When there's proximal blockage, okay, when we talk about proximal blockage, we've jumped a step. Let's first look at the PCOS. When a woman has PCOS, normally there are drugs which will be given to them. The drugs we give, or the drugs which are advised, are those drugs which actually stabilize the high male hormones. Remember, we said that polycystic ovarian syndrome, or PCOS, is a condition where a woman has high levels of the male hormone. So they give you drugs to bring down the male hormone, and then also afterwards they give you drugs to help you get pregnant, and of course also stimulate ovulation. Now, that's the main reason why you were given metformin. Much as we know that metformin is a drug which is used in the treatment of diabetes, a blood sugar disease, but in infertility, in issues with fertility and reproduction, we also recommend it for women trying to get pregnant. And that's why you were given metformin. And by the way, many women have been given Clomid and metformin and they've got pregnant. there could be something causing this, like causing your failure to get pregnant. So proximal blockage, you've not specified whether it was on the right side or on the left